Hi, everyone. Welcome back to the Kind Health Group YouTube channel and podcast. Today, we have a great guest with us. My friend, Dr. Ni Chang Liang, is a mother of two. She's a cancer survivor, American Lung Association San Diego Lung Health Provider of the Year, Pulmonologist 2019. She's a top doctor in 2019 and 2017 in San Diego. She's an inaugural Outstanding Mother Award recipient in 2019 and mindfulness teacher. She's the director of Pulmonary Integrative Medicine at Coastal Pulmonary Associates, affiliated with Scripps Health Network in Encinitas. And she maintains a voluntary assistant professor of medicine appointment at the University of California in San Diego School of Medicine, volunteering at their free clinic there. And if that wasn't enough, she has presented and led workshops and retreats nationally on mindfulness, physician well-being, integrative and pulmonary medicine to patients and all members of the healthcare team, and has been interviewed for webinars, podcasts, and for local news. She recently founded the Mindful Healthcare Collective, which is a group of women physician wellness experts who are leading free live Zoom sessions during the pandemic, and their website is mindfulhealthcarecollective.com, and that includes links to free meditation resources during this COVID-19 pandemic. You are amazing. Thank you for being here.
Thanks for having me.
Yeah, our pleasure. And Annie's here with us as well. Hi, Annie.
Good morning and welcome.
So I guess so many things we can ask you. And then I think in the second half, what we'd like to do is do a guided meditation. I think it would be helpful for everyone. But I think first off, tell us how you got to where you are today.
So I knew I wanted to be a physician pretty early on in life, in kindergarten, where I played a physician in the kindergarten school play. And then having grown up with a role model of a pathologist who is in my family. My aunt is a pathologist, now retired, and she was a role model for me growing up. She was part of the Air Force and was a strong East Asian American woman who was in the Air Force as a physician. So I looked up to her very much, and knew I wanted to take care of adults from working with a mentor at the George Washington University as an undergraduate student, then went into internal medicine, and really enjoyed taking care of sick people. And so pursued pulmonary critical care fellowship. And then during my second year of fellowship at UC San Diego, I was diagnosed with breast cancer. And that for me was my major wake-up call in terms of transforming how I take care of myself, first and foremost, knowing that you cannot take care of others unless you take care of yourself first and foremost. So having had cancer, needing to take a year off to pursue 5 months of chemotherapy and 3 surgeries, coming back into the practice of medicine with a newfound appreciation for self-care and wellness, not only for myself, but to be able to share my experience as a cancer patient to all healthcare professionals along with my patients. And that is it in a nutshell.
What were some of the first things that you made a change with once you were diagnosed?
For me, one of the first things was to up my fruit and vegetable intake drastically. So really increasing the quality of my diet. Unfortunately, medical training isn't always conducive to eating mindfully and also eating in a healthy way. So that was probably one of the first changes that I made once I got the diagnosis.
Did the mindful component follow that, or did you move from nutrition to mindfulness, or was there another step along the way?
The mindfulness component came a little bit later, in that I met Steve Hickman, the UCSD Center for Mindfulness founding executive director, during Cancer Survivor Day at UC San Diego. And when he spoke about mindfulness, being born and raised Buddhist, it immediately resonated with me. And so from that point on, I knew I wanted to embody it, practice it, teach it, and bring it to traditional allopathic medicine in a more formal and embodied way.
Do you feel like it's been difficult getting a lot of, physicians who really think in a more traditional Western medicine kind of way to embrace this? How has that been? I think it's mixed, but what's your experience?
So having been on the American Thoracic Society interest group committee for integrative therapies, was one of their founding co-chairs for that interest group. There's been a lot of support in the American Thoracic Society for it, and was able to participate in several literature reviews, mostly directed at patients. And so I think from the larger society perspective, it's gaining traction because there is decent evidence for some of these integrative medicine modalities. But I will say, in terms of the actual embodiment of mindfulness amongst healthcare professionals, sometimes that's been a bit more challenging, because when wellness programs are rolled out in healthcare systems, it becomes a very sensitive topic, and it becomes very sensitive how the wellness program is rolled out, because we don't want to approach a wellness program from a perspective of victim blaming or shaming or blaming the healthcare professionals for not being resilient enough or for burning out, because it's really not an issue with the healthcare professionals. It's really the system that has been causative to many instances of burnout. And so when it's rolled out with the integration of a systems perspective in terms of change for the better, to prioritize the safety and well-being of the healthcare professionals in the system, along with individual approaches like embodiment of mindfulness practice into the day-to-day of a healthcare professional, then that's ultimately all the more successful in rolling out a wellness program, as opposed to being like, you need to meditate more, or you need to do more yoga so you don't burn out.
What do you think the ideal connection would be between medicine and mindfulness? Like, if you could just, paint a masterpiece of what you want it to look like, what would it look like?
I think with mindfulness in medicine, there are already physicians that embody mindfulness in their practice of medicine. And so mindfulness is a lifestyle. So it can be embodied anytime, anywhere, doing anything. And so to more formally incorporate mindfulness, and some of the medical systems across the country already do this, but before rounds or during the beginning of a conference call or a meeting, to just take a pause for a couple of minutes of awareness of breath meditation before delving into rounds or the meeting at hand, to include rounds with patients that also allot for time for practicing mindfulness with patients, whether it be in the clinic setting or also during the stay of the inpatient course. And then to be able to have safe spaces, whether it be in formal meetings or spaces within the hospital where clinicians can gather to have formal debrief and to practice together more formally, and have that actually be built into their day, as opposed to putting the responsibility to find time in their day to try to practice it to maintain their well-being. So I think ultimately it's going to be the protection of time for clinicians to be able to practice mindfulness for themselves, with each other, and for patients. And so that they aren't feeling like if they choose to practice mindfulness, then they're not as clinically productive and therefore actually get penalized because they're taking quote unquote time away from clinical work RVU productivity metrics.
Yeah, so I totally agree. I think finding a way to inherently build it into the system of everyday practice is where it's at and where the struggle is. Do you find, what are your thoughts now with the COVID-19 crisis and, already being a group, healthcare workers as a group already, tapped out in terms of burnout levels and stress, and now this coming on top of it? Where do you think that's going to take us? What can we do differently? What are your thoughts on where we are now and where you think we're going to get?
The burnout levels were already at pandemic levels, as you had already alluded to. And with the COVID-19 pandemic, it's already getting worse, and it will get worse with pre-traumatic stress that's being experienced by clinicians who are watching things kind of unfold in other cities that might be predictive of what's going to be coming to their city soon. And then the actual emotional trauma, the moral distress that the current frontline workers and some of the hubs in the United States are currently enduring. I know that there are a lot of resources that are getting set up, inclusive of hotlines, crisis lines. There have been calls for volunteer psychiatrists and psychologists to help with manning hotlines so that healthcare professionals who are on the front lines are not alone in dealing with the emotional turmoil that they're all going through right now. There's also a lot of different resources online, almost like a bombardment of resources online for Zoom sessions. Lots for the general public, and then the healthcare professional ones, like at Mindful Healthcare Collective, and also through some of the other private entities like Empowering Women Physicians, for instance, just did a whole week long of daily coaching debriefs on Zoom. I think that now is the best time to come together as healthcare professionals to stand united in the face of the COVID pandemic while prioritizing wellness.
What have you been sort of turning to? Have you been turning to, the Zoom calls to sort of, collaborate with other doctors? What have you been using, and what have you found useful?
So the Zoom calls that have been set up for the Mindful Healthcare Collective have been run by women physician experts in wellness. So many of these women are coaches, many of them are mindfulness teachers, some of them are yoga instructors, and others have their own meditation practice that they've created. So they've come online to lead other healthcare professionals together live once to twice a week for an hour in debrief in terms of what everyone's been experiencing, whether it be on the front lines or telehealth or wherever, and then going into a formal practice in community. And I think that's been emotionally very helpful for me personally. The other aspects have been coordination of donations, knowing that PPE shortages are rampant throughout the country. I've been lucky to be part of coordination efforts in increasing donations of PPE to the local hospitals. And so while I'm off this week, quote unquote, from clinical care, I've found solace in helping out in non-clinical ways like that. I would also say that having a social media and a news diet several times a day is helpful because we can get so wrapped up in the storylines and the catastrophizing of everything that's going on right now. And that might not necessarily immediately serve us and our needs, nor the needs of our family members that are immediately around us, or our patients, for those of us who are still involved in clinical care right now. So I think it's really important more than ever to be mindful of the consumption of social media and news right now too.
Absolutely. What is I know you're off right now. When you go back to clinical care, what is that looking like for you these days?
So in the weeks leading up to this week, my office at Coastal Pulmonary, we were already converting a lot of outpatient clinic visits to telehealth and getting that set up and online and developing protocols for what that looks like. So next week when I go back, the vast majority of my clinic visits will be telehealth. But unfortunately, lung masses and pulmonary embolisms and deep vein thromboses don't go away. And for the limited amount of patients that are going to be coming into the office, we'll be there for them, and we'll be undergoing screening processes for them at the door in a separate triage area before they come into, quote unquote, the clean waiting room area. And then we also conduct phone screenings before they even step foot into the clinic, because anyone who has symptoms that might even be remotely COVID-19 related will be told to home isolate and provided with further instructions before they even step in the office. So a lot of it is going to be telehealth. There will be just a few in-person visits for kind of urgent new patient or post-hospitalization follow-ups that can't be done over telehealth. But by and large, a lot of it will be through telehealth.
What about the hospital? Are you seeing patients in the hospital setting at this point, or?
I am not currently, but I am on what we call Jeopardy or backup call. So if there is a patient surge, which we anticipate there will be, I'll be helping to round on the inpatient consult service, for instance, and probably help out with the coronavirus patients too.
So in San Diego, it seems that our numbers have been our COVID-19 case numbers have not been as high as some of the other cities in the country. Obviously, what do you attribute to that? Do you think, where do you see our city's health, county health going?
I think that even though the projections are still early, I do think that social distancing relatively early on compared to the rest of the United States has been helpful and working. And of course, across the country, the numbers aren't super accurate because there still is a lack of tests all around. And so the incidence and prevalence are probably way higher than in actuality, but at least the caseloads of what we're seeing as positives, they seem to be increasing per day less than in other hotspot areas of the United States. And I think one advantage of San Diego County is that San Diego County is huge. And so we're relatively spread out compared to a high density population area like New York City, where I think I read statistics of like over 20,000 people in 1 mile squared is the population density there. And so that 6-foot social distancing metric isn't really readily able to be met in a highly dense area like that versus San Diego, where the county is so spread out. So I think our own geography is advantageous to the situation at hand right now. I do think that there's going to be a surge. I think we're still very early on into the disease course. I think that the surge will come in the upcoming weeks, but we're hoping to, with these social distancing measures. Actually, I want to correct the social distancing terminology in saying that it's more physical distancing, because we're actually not necessarily social distancing. Many of us are gathering on Zoom to form a community of social networking and social closeness while physically we are distancing. So I just want to say that the physical—
I like that. That's what we've been saying too.
Yeah. The physical distancing measures are hopefully going to flatten the curve so that our hospitals are not overwhelmed and that we have enough ICU beds and ventilators. But plans and protocols are in place as we speak in case of that surge. But I do strongly believe that the surge is coming and we haven't seen the peak of it yet. And if I'm wrong, then it means all the physical distancing measures worked, and I'd gladly be wrong.
Yeah, I agree. Is there a part of your practice that lately you've been depending on more? Or, I mean, I know teaching mindfulness is a gift and you have your own practice developed. Is there something that you've been I don't know, is it setting intentions more or actually having more time to meditate lately? What has been helping you stay grounded? I know your kids are home, life is different.
That's a great question. I think the loving kindness meditations have been particularly helpful for me. Um, so just recently, I finished off teaching online mindfulness-based stress reduction for the last 3 weeks, and then also finished up a mindful doctoring course, all done on Zoom. And it was timely because the endings of these courses came around the time of the COVID pandemic, and so the loving kindness meditations that I've led have been immensely helpful for me and also the participants in terms of setting out the mere intention of positivity and wishing um, for wellness for all people who are affected right now. I think has brought a sense of spiritual and emotional community that before COVID-19 it wouldn't have brought about. So that to me has been really, really helpful and I think emotionally very powerful for many of the participants, knowing full well that the mindfulness-based stress reduction class largely was comprised of patients from our pulmonary practice who were at risk and at higher risk basically of contracting coronavirus and of the complications related to it. So I think they felt empowered to be able to contribute.
So on that note, would you like to lead us in some loving kindness guided meditation? We would love that.
Yeah, I would be glad to do that. So I will have my bells here that basically signal the beginning and the end of practice. And so we'll use those as a signal for that purpose. So inviting you to close eyes if that serves you, or lowering your gaze a few inches in front of you. Choosing a position for your body that is upright and comfortable for you. Checking in with your alignment, making sure that your head sits atop your neck, atop your shoulders, atop your hips. Perhaps noticing that you're sitting a bit more upright. Placing hands in your lap comfortably or top your thighs. And simply begin by noticing the points of contact between you and your environment. Perhaps noticing the sensations of the feet against the ground, or of your bottom against a chair or a cushion or a couch. Allowing yourself to fully arrive in this moment, leaving everything that came before and that is to come at the door. Giving yourself permission to arrive now, to be here. And as you're ready, I invite you to place a hand over your heart, recalling to mind a person that provides unconditional love to you, that you unconditionally love back. This person might be a partner, spouse, a child, a parent, a sibling, a dear friend, someone that you can call into your mind's eye that is unconditional love for you. and saying to this person silently within your mind, sending all these good intentions to this person. May you be well. May you find peace. May you be happy. May you be free from harm. May you be well. May you find peace. May you be happy. May you be free from harm. May you be well. May you find peace. May you be happy. May you be free from harm. And thanking that person for unconditional love and letting that image of the person drift into the back of your awareness. Conjuring up the image of someone that is quite neutral for you, perhaps an acquaintance, a neighbor, a cashier at the grocery store, or a mailman or mailwoman, someone that is neutral for you, and wishing those same intentions to that person. May you be well. May you find peace. May you be happy. May you be safe from harm. May you be well. May you find peace. May you be happy. May you be safe from harm. May you be well. May you find peace. May you be happy. May you be safe from harm. And thanking that neutral person in your life for being part of your practice, letting that person drift into the background of your awareness, inviting you to conjure up the image or the presence of someone that might bring you some difficulty. And this person might not be your mortal enemy, perhaps someone that is not so negative in your life that it becomes too distressing, but choose someone that brings a bit of difficulty for you. And bringing the wishes of those well intentions to this person as well. May you be well. May you find peace. May you be happy. May you be free from harm. May you be well. May you find peace. May you be happy. May you be free from harm. May you be well. May you find peace. May you be happy. May you be free from harm. And thanking that person for being part of this practice, letting the presence or the image of that person drift into the background of your awareness. Seeing if you can envision now all the members of your household currently sitting present in your home or your office right now. Bringing their images to your mind's eye or the sensation of their presence to your mind, and wishing your entire household, perhaps the people that you are in physical distancing quarantine with right now, the same. May you be well. May you find peace. May you be happy. May you be safe from harm. May you be well. May you find peace. May you be happy. May you be safe from harm. May you be well. May you find peace. May you be happy. May you be safe from harm. And then broadening the good intentions to include your neighborhood. This encompasses your cul-de-sac, perhaps the houses, the apartments, the condos nearby that would go to your same school district. Wishing all of those people in their homes the same. May you be well. May you find peace. May you be happy. May you be safe from harm. May you be well. May you find peace. May you be happy. May you be safe from harm. May you be well. May you find peace. May you be happy. May you be safe from harm. And broadening those good intentions to encompass your entire town. This might include all the homes with all of the different schools in your town, perhaps even the shopping centers, the gas stations that are in your town, encompassing all of the households that are in your town, wishing all of them the same. May you be well. May you find peace. May you be happy. May you be safe from harm. May you be well. May you find peace. May you be happy. May you be safe from harm. May you be well. May you find peace. May you be happy. May you be safe from harm. And spreading those good intentions to include your city. So this might include multiple different towns, perhaps some hospitals in your community, other shopping centers, businesses, restaurants in your city, extending to every human being that is currently residing in the city the same. May you be well. May you find peace. May you be happy. May you be free from harm. May you be well. May you find peace. May you be happy. May you be free from harm. May you be well. May you find peace. May you be happy. May you be free from harm. And then spreading those good intentions from the city to encompass the entire county. The county of San Diego is quite large. So envisioning perhaps a map of San Diego County and broadening the good intentions to encompass the entire county, wishing everyone in the county, may you be well, may you find peace, may you be happy, may you be free from harm. May you be well, may you find peace, may you be happy, may you be free from harm. May you be well, may you find peace, may you be happy, may you be free from harm. Now broadening this blanket of good intention to encompass the entire state of California, where multiple counties are some more affected than others with the pandemic, but in shrouding the entire state of California in your good intentions, perhaps envisioning a spreading of warmth and well wishes to an image of the map of the state of California, wishing everyone the same. May you be well. May you find peace. May you be happy. May you be free from harm. May you be well. May you find peace. May you be happy. May you be free from harm. May you be well. May you find peace. May you be happy. May you be free from harm. And then spreading those good intentions, perhaps envisioning the United States of America, a map of it, as it becomes encompassed slowly but surely with your good intentions to wish the entire country the same. May you be well. May you find peace. May you be happy. May you be safe from harm. May you be well. May you find peace. May you be happy. May you be safe from harm. May you be well. May you find peace. May you be happy. May you be safe from harm. And continuing to spread your good intentions like a blanket enshrouding all the countries of the world, perhaps conjuring up an image of Earth from NASA or a globe that you might have in your home, wishing all inhabitants of the Earth right now the same. May you be well. May you find peace. May you be happy. May you be free from harm. May you be well. May you find peace. May you be happy. May you be free from harm. May you be well. May you find peace. May you be happy. May you be free from harm. And then gently coming back from the image of the Earth, the United States, the state of California, San Diego County, your city, your neighborhood, your household, bringing up the image of you, your own presence in your mind's eye, wishing yourself the same as well. May I be well. May I find peace. May I be happy. May I be free from harm. May I be well. May I find peace. May I be happy. May I be free from harm. May I be well. May I find peace. May I be happy. May I be free from harm. May I be well. May I find peace. May I be happy. May I be free from harm. And bringing a sense of gratitude for yourself to being open to do this practice, for those good intentions that have been sent out to the world, to yourself. Because right now we are one, unified against a common threat, realizing that we all want to be safe and well and happy and free from harm, just like everyone else. We're not alone. The world is our community. Coming back into the sensations of your body against a cushion or this chair or couch, the support of the ground beneath your feet. Bringing an awareness to perhaps how you feel now in your physical body compared to before the beginning of practice. And noticing your breath at your nostrils. Knowing that this is a constant that you can use as an anchor at any time. Realizing that regardless of other thoughts, emotions, or other body sensations that might capture your attention, you always have your breath as the anchor to bring your attention back to. We're all breathing. And giving yourself some time for self-care, blinking open eyes and stretching or readjusting your seat and just checking in, noticing how you feel now compared to about 20 minutes ago.
Thank you, Ni Chang. Thank you. That was absolutely beautiful. Any final thoughts that you want to leave us with before we close?
Yeah, so everyone is facing uncertainty right now, and that is scary and fear-inducing, but it can also be reframed as opportunities to be in community in the face of uncertainty. And really, if you think about it, the only certainty in life is that it is uncertain. We're just more aware of it right now with the coronavirus pandemic. But what we can be certain is the present moment. So because I like to try to quote Kung Fu Panda whenever I have an opportunity to do so, Master Oogway, who's the turtle sage, tells Po, yesterday is history, tomorrow is a mystery, but today is a gift, and that's why it's called the present. So you only have now, and using the present moment experience as your anchor to come back to the now might be more helpful in our current predicament than ever before. And so just to remind everyone that you only have now and to take full advantage of that.
Thank you. Thank you so much. I really love that you reference an anchor because we are in a storm and you can use your breath as an anchor right now. That was very helpful. Thank you.
Thanks.
Thank you so much. I really appreciate you and you taking the time out of your day today to be with us. And we're going to share this with as many people as possible to spread the love and kindness.
Thank
You're
you.
awesome.
Thanks for having me.